So in this video, I will explain what is duodenal switch. Now, duodenal switch is a form of weight loss or bariatric surgery which has the best results in terms of weight loss as well as cure for medical conditions, particularly diabetes, blood pressure, cholesterol, sleep apnea. It is the most aggressive and complex reconstructive surgery. I have been personally doing duodenal switch for more than 10 years now, and I do it on selective patients who need duodenal switch. So, who are these patients who need duodenal switch? If you have very high weight or BMI, this may be a right operation for you. Or if you have a bad insulin, resistant diabetes, you are on insulin pump, this may be an ideal operation. Or your medical conditions, particularly sleep apnea and other things, are bad, this may be a good operation. If you have severe reflux of bile, this can be a good operation. So, what do we do in duodenal switch? It is a complex reconstruction, but it differs from gastric bypass. The first difference is in gastric bypass, you have a small pouch on the top, so you can eat just small amount of food. However, in duodenal switch, we don't create a pouch, but we remove the excess portion of the stomach, kind of sleeve, but it's much larger than the sleeve. So these patients, they can eat almost regular volume of food. The second difference is you leave the pylorus intact. Pylorus is a valve between your stomach and the intestine. So these patients have a regulatory mechanism by which stomach can empty into the duodenum. And because of this, these patients rarely get what we call dumping syndrome. So that's another advantage of duodenal switch. In duodenal switch, you bypass long segment of intestine. So the joining between the sleeve and the other portion of the intestine is very close at the last portion. So the undigested proteins, they reach the intestines and they have a complex interaction with the liver through interleukin, and that cures your diabetes almost within 24 hours. So it is complex reconstruction, but the benefits are amazing. The other advantage of duodenal switch is there is much less risk of developing ulcer. We call it marginal ulcer, which are little common in gastric bypass. So because of these three advantages, namely less risk for marginal ulcer or gastric ulcer, no dumping, and best resolution of comorbid condition, and ability to eat good amount of food. These are the three big advantages for which duodenal switch is performed. There is a variation of duodenal switch which just got approved by Society of Bariatric Surgery, and it's called loop duodenal switch. By doing a loop duodenal switch, you prevent one anastomosis or connection between the intestine. So it's less complicated in terms of construction. The long-term results of loop duodenal switch is unknown. All these surgeries are performed laparoscopic through tiny holes. I personally, for last several years, have been doing duodenal switch using the robot, which has a definite advantage of being more precise, more gentle tissue, less chance of bleeding, and much faster healing. The duodenal switch, if you are a candidate, the first step we have to do during the evaluation is go over your medical conditions and do a procedure called endoscopy to understand the anatomy of your stomach. If you are a candidate for duodenal switch or you want to have more inquiries, please call our office 904-399-4004 or visit our website sharmasurgery.com, make an appointment, and I'll be happy to discuss further. Thank you so much.